sip of water in your mouth and hold it for me. I'm going to palpate the right side, right? So I'm going to come over here, slip my hand in, turn it that way, and then swallow. Okay, good. All right, so we've moved on and done the thyroid. Now I'm going to ask you to swing around, and I'm going to do the posterior aspect of the chest. I'm going to have you cross your arms in the front and hold up your gown like that for me. That's good. Great. So I have a good broad exposure. My hands are free. I'm just going to inspect his posterior thorax, looking at it as a bony thorax to see there's no obvious kyphosis or there's no winging of his scapula. I'm actually inspecting the scapula and palpating the scapula. I don't see any abnormalities of the bony thorax or cage. I'm just going to palpate over his spine. If any of that hurts, Mike, let me know. Down here to the gluteal cleft. Costovertebral angle tenderness while I'm there. None? No pain? Just going to do some paraspinal muscle palpation over those muscles. Any tenderness, Mike? Okay, good. Bless you. Okay, at this point, I'm going to check thoracic expansion. I want you to take a deep breath in, Mike, and exhale. Good. That's nice and even. Mike, every time you feel my hands on your back like that, I want you to say the word clearly 99. Okay? Go ahead.
Clearly 99.
Oh. Just say 99.
99. 99. 99. 99.
Okay, good. Just relax. Okay, now I'm going to percuss, starting at the apices. Notice how high up I am. And I need to get 4 places on the posterior aspect of the thorax. 1, 2, 3, and the base. 4. I'm going to do my laterals here. You can do an anterior approach or a posterior. And you can do 2 at a time there. It's okay. And next, I'm going to auscultate with the diaphragm. Mike, when you feel my stethoscope on your back like that, I want you to take some nice breaths in and out with your mouth open. First, I'd like you to just take with your mouth open, just a nice breath in and out, just to see that nice, even expansion. Okay, so now every time you feel my stethoscope, good. Apices. Now I'm going to do the posterior thorax, 4 places. Now rest for a second. I want to get the bases nice and deep. Good. I'm going to do my laterals here. Breath. 1 more. Compare it to this side. Okay, good. All right. Can you swing around this way? We'll let them see the front because you saw the, they saw the, okay, we'll let, you saw something. They saw the back. Okay, I guess they still need to see. They need to see. I'm trying to figure out what you didn't see. Okay, so now we're going to go to the anterior thorax. Again, looking for bony deformity, pectus excavatum, carotid. Nice breath in and out for me. Okay, good. Nice, easy breathing. Checking thoracic expansion. Deep breath in and exhale. Good. When you feel my hands, say 99.
99. 99. 99. 99.
Okay, I'm just going to palpate that anterior chest, intercostal muscles, any tenderness. Just see if there's any tenderness along there. And there doesn't appear to be any. Again, you could do a lateral aspect, 99.
99.
With any of what you do, you could do an anterior approach to your lateral aspect. So I've thoracic expansion, I've palpated, I've not percussed yet, and I've done, I just did frontages. Okay, so we're going to percuss, again, apices over, supraclavicular. And 3 approaches, or 3 spaces. Again, you could do anterior, laterals if you want here. I already did them. Now I'm going to auscultate again with the diaphragm. When you feel my stethoscope, mouth open and breathe. Good. 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 Okay. Good. All right. I'm going to move on and I'm going to go to my upper extremities. I'm going to start just by inspecting the upper extremities. When I'm looking at the upper extremities, I'm looking and checking for muscle tone, see if there's atrophy, looking for symmetry. As I inspect the joints, I'm going to be looking for redness, swelling, or any deformity. So I'm going to just start. I've already done the scapula from behind, get the shoulder, and the upper arm, the elbow, inspecting it again, no deformities there. Could do your brachial pulse and radial pulse here if you want. The forearm, I'm going to come down here to the hands, the wrist. I'm going to go over the DIPs, the PIPs, palpating laterally each of those. and then the carpals, okay? Great, what I do to one side, I need to do to the other. Inspecting again for the redness, the swelling, tenderness, the wrists, the joints. I already did my nails. Some of you may choose to do your nails here. It's pretty logical. I just have them where I do, so that's the story. We're going to do some range of motion now. I'd like you to squeeze my fingers. I'm going to do straight and tone too. Squeeze my fingers as tight as you can. Pull me towards you. Pull me. Push me. Good. Let go. Push in my hand. Pull towards you. Push in my hand. Pull towards you. Okay. Put your arms out like this. Push out. Push in. Good. Okay. Put your hands down. Take this arm. Circle it around. Touch your back. Put it by your side. Take this arm. Circle it around. Touch your back. Put it by your side. Hands by your side. Bring them up like this. Bring them down. Up. And down. Cross. Cross. Okay. Good. All right. Put them down. Curls. Okay. Good. All right. So now we'll go here. Flip the pancake for me. Okay, good. And flip the pancake for me. Good. All right. While you're here, let's see. Let's do your hand up and down, side to side. Roll it around. Open and close your fingers. Okay. Moving down here, up and down. I isolate, so make sure he just does that hand. Roll it around and open and close your fingers. Okay, good. Put your hands out like that. Okay, try to squeeze my fingers. Keep your hands straight. Yeah, that's it. Good. Put your hands together. Don't let me pull them apart. Okay, good. Make rings like this. Don't let me break them. Good. Start with your hands like this. Pull your thumbs over and slowly close them up. Don't let me. Good. All right. Push up against my hand. Push down against my hand. To the side. To the side. Push up against my hand. Push down against my hand. To the side. And to the side. Okay, good. All right. Can you do this? Can you touch your finger to your thumb to your good? Can you do that as fast as you can? Good. All right, Mike. What I want you to do is take your right index finger and touch your nose, and touch my finger, and then do that as fast as you can. Except I'm going to move my finger around.
Okay.
Okay, good. Do the other side. Got to do the other side. Don't forget the other side. Whatever you do to one side, you got to do the other. Okay. Now I'm going to do eyes closed. I want you to close your eyes. Put your arms out by your side. Hold them straight out by your side. Take your right index finger and bring it to your nose. And back out. Left index finger to your nose, bring it back out. Both index fingers to your nose, bring it back out. Good. All right, you can open your eyes. Mike, can you do this? Okay, that way you get it done together. Some of you may do it individually. That's fine too. Okay. Blah, 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 blah. So I'm going to put you forward now. Let's kind of, I guess we'll go forward. I'm going to do the heart. So I'm going to, make sure I do all okay, I'm going to inspect the precordium. I'm looking to see if there's any heaves or lifts. I'm going to palpate over the auscultatory areas, aortic, pulmonic, herbs, tricuspid, and mitral, feeling for any heaves, lifts, or thrills. Feeling none, I'm going to try to palpate for the PMI. Oh, yes, right there. Good. Now you have to, if you have this stethoscope, you have to make it clear what you're doing. I'm going to start by auscultating the heart with the diaphragm, aortic, listening for S1 and S2, pulmonic, third intercostal space, left sternal border is herbs, left lower sternal border is tricuspid, fifth intercostal space, mid-clavicular line is the mitral, again S1 and S2, no murmurs, rubs, or gallops heard. I'm going to ask you to lean forward for me, just like that. I want you to exhale, blow all your air out, and just hold it in exhalation, listening at aortic and pulmonic, listening, good, breathe, listening for the murmurs of aortic regurg or tricuspid insufficiency. Now I'm just going to do the same auscultatory areas that I've already named with the bell, which is lighter. Okay, good. Hey, what were those three things? Do you remember?
Cow, bell, lamp.
Okay. Could you lie down for me, Mike? Put your legs out. You comfortable? Everything okay? All right, good. And we're just going to kind of bring this up to here. Straight. All right, I'm going to do, again, you could do your inspection lying down. You could do your PMI. I'm just going to go to auscultation because I've already done it. Again, the 5 auscultatory areas. I'm starting with the diaphragm, aortic, pulmonic, which are second intercostal space, right sternal border, left sternal border. Left sternal border, third intercostal space is herbs. Left lower sternal border is tricuspid. And the mitral position at the apical impulse. So I don't hear any murmurs, rubs, or gallops. I'm going to go with the bell. Mike, I'm going to turn you on your left side. If you could just roll for me with the bell in the mitral area, listening for that low-pitched diastolic murmur of mitral stenosis or tricuspid. Don't hear any, Mike, so we're in good shape there. That's always a good thing to know. Okay, can you just put this on for me? Keep it bound up. Okay, I'm going to move on to the abdomen. Okay, I'm doing a general inspection of the abdomen. I'm going to have to put your hands by your side. General inspection, I'd already done his skin everywhere else, but I'm going to look at the skin for those things that I named before: color, moisture, vascularity, temperature, texture, thickness, turgor, and mobility, presence of any lesions, none. See nice belly breathing. I don't see any distension. I don't see any abnormal, any peristalsis, visible peristalsis. So it's kind of calm. There's no scars. I'm going to now auscultate with my diaphragm all four quadrants for bowel sounds. Left upper, right upper, left upper, left lower, right lower. While I have my ears in, I'm going to use the bell, which is light, and I'm going to auscultate over the aorta for any bruits. The renals, which are just under, just to the side of midline and right under the costal margin. Come down just inferior to the umbilicus for the iliacs. I'm going to do my femorals later. Okay. Next, I'm going to do percussion. I'm going to start with general percussion. Empty bladder?
No, I can pee.
Oh, no. I'm going to come over here, anterior axillary line between the 6th and the 10th rib. Deep breath in and exhale. No change to dullness in the area where a spleen could come in. We're going to next assess his, try to percuss out his liver borders. Start down low here. Okay, there's our lower border. Mark that. Start up here. Okay, change to dullness. We'll measure that, and that is 5.5 centimeters. I'm going to move on to palpation. I'm going to start with light palpation. Any spasticity, tenderness, any of that hurt? You can feel my hand in your belly, that shouldn't hurt. Okay. Having none, deep palpation. Why don't you bend your knees for me and breathe with your mouth open. Just relax your belly. I don't want your six-pack abs. I want it nice and soft. There you go. And again, my top hand is pushing. My bottom hand is trying to capture any masses. Again, tenderness. Okay, while I'm here, one hand underneath, this hand here, we're going to palpate for the kidneys. I'm just going to reach over and again palpate for the kidneys. We're going to do the liver. I'll do it both ways. Pick one way. I'll start up here. If you're going to hook the liver, I want you to take some nice breaths in and out. Put your legs down. Let's see if they can see. But try and relax your belly. Breathe with your mouth open. Deep breaths in and out. I'm right around the costal margin. Just letting them get used to me. Deep breath in. Good. Okay, and relax. Now if you're going to hook, you stand down here. Left hand goes underneath to support and push up. Right hand runs parallel with the costal margin. Again, deep breaths in and out. Deep breath in. Good. No big little. That's good, Mike. I'm going to come over and do the spleen. My left hand reaches over and pushes up. My right hand is parallel with the costal margin. Mike takes some deep breaths with his mouth in and out. Open. Deep breath in. See how far underneath I get there. I'd like you to roll on your right side for me, Mike, so we can do that procedure again. You have to do both ways. So again, I'm going to support his back, and we got some deep breaths in and out. I'm running parallel with the costal margin. Deep breath in. Good. Okay. So go ahead, you can roll your back again. Thanks. Okay, I'm just going to come down here and palpate the aorta, which is right about at midline. So we've done the liver, the spleen, the aorta, and the kidneys, and the general abdomen. That now leaves me with my favorite place. We're going to do your femoral pulses. They'll tell you I'm right on it, nowhere else. femoral pulse,